Hey guys, Dr. Castillo wanted to go over a quick exam today. This will be all in Spanish. This would be great for just walking you through the basics. I mean, it's really not that hard. Hopefully your exams are gonna be 30 seconds to a minute. I mean, I'm just being real, you don't have to do that much. Now, for our personal injury patients, obviously we have to do a more thorough examination, but it really doesn't have to be that big of a deal in terms of what you have to say to the patient. A lot of times they're there just to listen to you, command them and to do things, right? So, I mean, obviously you're gonna wanna know the four basic commands, you know, boca abajo, which is face down, boca arriba, which is face up. If you do de lado, if you're doing side testing, I mean, to be honest, I don't do side testing, so it's either first start boca abajo and then boca arriba, and then I usually transition them into sentada, which is seated like this, sentada, and then parada, which means standing. Or you can just say levántense, which is a command that says standing. Now, when you're making commands to people, make sure you say please afterwards because it's polite to do so, right? You're literally telling them what to do. So if you're gonna have them go face down, you say boca abajo, por favor, right? And it's just polite to do that. So during the testing, like let's say we're doing boca abajo and you're putting stress on those SI joints for like Yeoman's test. As they're on the table, I might tell them, voy a tocar aquí en las caderas. I'm going to touch here, especially for females, right? You're gonna wanna let them know what you're gonna do before you do it. So, and then you do Yeoman's testing. If you wanna do knockless is another good one. As I'm palpating the spine too, I might tell them like voy a tocar la espalda, right? I'm going to touch the spine, and as I'm going over there along the spine, I'm palpating areas of discomfort. And then the big thing with the exam, because really the exam is the tool, but really the whole meaning of the exam is to find out what's wrong with the patient and to really let them know like, yeah, I feel that there. Do you feel that, right? So like if there's low back pain and the patients are like groaning in pain, like, yep, yo siento tensión aquí. I feel tension. Or you can even tell them boldly, yeah, I feel the pain right here. Yo siento el dolor aquí. Or yo siento, like I feel that there's a problem. Hay un problema aquí adentro de los huesos. There's a problem with the bones right here. So I'll interject phrases here and there to make sure that we're all on the same page and that I'm finding things that are wrong with the patient. Genuinely, right? I'm not just randomly saying it, right? And then I might have them go face up. So, boca arriba, por favor. I'll adjust this guy. I might do straight leg raise, that's a really common one. Voy a levantar la pierna, like that, just like that. Voy a levantar la pierna, just like that. And during the exams, I might tell them, te duele or molesta? Does that hurt or does that bother you, right? Because if it hurts, I mean, that's one thing, but what about if it bothers them? You know, you want to let them know, hey, does it hurt? Or you might say duele, or you might say dolor, pain, right? Just ask them a question along those lines to make sure that they're on the same page and that they're able to convey to you what's wrong or where it hurts. After straight leg raise, I might do Faber's test. Faber is where you have the legs like this, okay? And then you're pressing down, ask them, especially like for the females, right? Voy a tocar las piernas, okay? All right, I'm gonna touch the legs, okay? And then wait for that affirmative nod, touch the legs there, make sure that the Faber's test, see if any of those are positive. And then you'll have them sit next. So sentada, por favor. So now they were face up, now they're seating. If you want to do Kemps, you certainly can. If you're going to do Kemps, make sure instead of telling them what to do, just say repite, por favor, and then show them what you want them to do. So repite, por favor, and then they'll just do something. Sometimes they'll mess it up and then you just position their arms how you want them. And then you might tell them like, hey, relájate, or relájate, and then you just guide them through the motion, do the Kemp's test. You can do Bechterews too if you want. There's a There's a little bit of a command that I use for resisting tests. They're great for like people that do AK, applied kinesiology. Let's say you want to do like a resistance on the deltoid muscle, right? You're behind the patient, you got this, and then you press it down on here. You want to tell the patient, voy a empujar aquí, pero dame fuerza, okay? And do like this with your fist, like strength, fuerza. That's what fuerza means. So I'm basically saying like, hey, I'm going to push, or voy a puchar, that's informal, for I'm going to push, right? Instead of, I use puchar, I think it's very informal. Patients use it on me all the time. But if you want to be formal, you could say, voy a empujar, I'm going to push, right here. Pero dame fuerza, right? So then let's say for example, they don't listen and you just push and then it just goes down because they're not resisting. You would say to them, no, dame fuerza, like give me force. And then they're like, oh, okay, I know what you're doing now. And then you press down, hopefully they resist, press down. You might say otro lado, other side, press down. Now that's just one example. Let's say you want to do like the biceps, you would do the same thing for like all the different strength tests, you know, the wrists, the fingers. I'm just being really thorough. I'm not doing these every single time, but for those of you who do more testing, like you'll want to know that stuff. So definitely say voy a empujar or voy a puchar, okay? And then after the sitting test, remember they're standing or sitting, now you would have them stand, so you'd say, levántense por favor. And then let's say you have them do some range of motion, like repite por favor, so that'd be like boca abajo, boca arriba, rotación, and then you'd have them do like that, repite. I usually tell them like, repite por favor, and then I have them go through all of those exams. After the exam, I'll usually tell them what happened after the exam and what I found. So I might tell them, después del examen, yo encontré problemas con la cadera, la espalda, y el hombro, right? I'm just giving you body parts off the top of my head, so that they're able to confirm, like, or at least be in agreements with me. Oh yeah, we definitely did go over that stuff, and yeah, I can see how I have a problem there. And then if I'm going to take x-rays, I might tell them, eso es la razón que necesitamos hacer radiografías para chequear la condición de los huesos, los tendones, los ligamentos, de todo. Vamos a tomar radiografías. We're basically saying this is why we're going to need to take x-rays. We want to find out what the condition of your bones are and how complicated your condition is. Not verbatim what I just said there, but that's essentially the gist of why I would do x-rays in the first place. I might do x-rays after an accident, somebody that comes in, slip or fall. I personally don't do structural correction like CBP or Pedibond, but I do use the x-rays as a viewpoint and a great visual tool to explain to the patient why they might be experiencing pain and how serious or complicated their condition is. So x-rays are a great tool. And a lot of times patients are really curious because in the consultation room, they can see the x-ray machine. So sometimes people are really actually very curious as to what is going on with their spine, and especially if they've never been to a chiropractor or if they've never been to a place to have x-rays taken. And maybe in the past they've had x-rays taken, but nobody's even ever showed them what the x-ray showed. So why not us? What a great tool to use. So just as a review, we went over face down, face up, seated, standing, different tests. And after the exam, hopefully you'll be able to kind of decipher what's going on with the patient and what needs to be done in order to move on to the next step, whatever it is in your treatment flow. So there you have it. That's how you do a quick exam. If you have any other questions on different exams that need to be done or different phrases that you want to be able to say, feel free to message me or start a comment stream. I'd be glad to have a dialogue with you. So have an awesome, blessed day, guys. Take care.